Okay, everybody, welcome back. This is going to be another longer video where we're going to be discussing the 7th procedure or our suicidality procedure and eligibility for telehealth services criteria. So this procedure is going to outline what needs to happen prior to a telemental health session regarding suicidality screening and what needs to occur when patient screens positive and general precautions and procedures that has kind of been established for these patients. So pause this video if you want, read the general procedure criteria. However, I'm going to go ahead and read this to you anyways. The Columbia, the CSSRS, is going to be used to assess the patient's recent suicidality, and every telehealth patient that we see in behavioral health will have a safety plan with special spots in it. All telehealth patients have a safety plan, regardless of historic suicidality, and patients must be able to identify a support person without emergency contact who can be available by phone if needed. And again, just a reminder, please let our patients know to tell the emergency contact when their appointments are, just so that emergency contact knows that, hey, during this time, during this day, I need to be a little more attentive to my phone in case I get a phone call, okay? This person does not need to be in those visits. If they would like to attend during safety planning, assuming they have a way over phone or via tele to get in, they are welcome to join, but it is not required. Okay, so completing the CSSRS, this is largely going to be patient-driven and sent out by the PCRs prior to every telehealth session with DocuSign. So the PCR will send out the BH Telemental Health Assessment Packet via DocuSign to the patient for completion. And the PCR will then review the CSSRS and follow one of the two scenarios we're about to get into. Providers, you are set up to receive a copy of these as well so you know what is going on, okay? So here's the first scenario. This is what's going to happen if we get back that CSSRS, the Columbia, with a positive screen. So a positive screen will occur when questions 4, 5, and 6 have been answered yes, okay? 1, 2, and 3 can be answered yes, but we'll still proceed with the telehealth session. So here's what needs to occur. The PCR will notify the patient that because of the positive screen that their next appointment will need to occur in person, and the PCR is to schedule that appointment at the earliest available time. This is the one instance where in behavioral health at least, we're going to be using a walk-in appointment for that if needed. These are oftentimes our earliest appointments and the most accessible. And when someone does score high for a suicidality screener, we want them to come in and get assistance. The provider will then connect with the patient via Doxy to discuss what's going on and make a clinical decision regarding the patient's safety. And that decision can include the following. Not unlike meeting with a person face-to-face in clinic. I mean, probably just to be honest, we don't have control over what these people do, and just because they're at home doesn't mean that they're necessarily at more of a risk than them coming in here, right? So as a provider, your recourses could be calling 911. Our patients need to be at the physical address where they've told us in the release they're going to be at for all of their telehealth sessions. As part of our process, during the beginning of the calls, we need to be asking our patients where they are at. This is largely going to be our our PCR's job to ask that question. Get an actual physical address. We may also include activating the client's emergency support, that emergency contact. We have a release. We can give them a phone call from our office phone. We can even send them a Doxy link if they have the capability to join that call with us to discuss some safety planning that's needed. We can also activate the client's safety plan for de-escalation, right? If worse comes to worse, if that call were to drop, we're going to get back in. We can always call 911 to do a welfare check over to that patient, okay? The provider then will finish the session, plan for follow-up, and ensure the client knows when their next in-person appointment will be. During the in-person session now, the provider should continue the conversation regarding suicidality, collect a history, and further evaluate the mental state of the patient. Upon termination of this in-person session, the provider will need to document a decision whether the patient will return to teletherapy and what the plan for re-engagement will be. The next scenario is going to be the negative screen. A negative screen occurs when questions 4, 5, and 6 have been answered no. If this occurs, the following actions will be taken, right? We're going to complete and review the the Brown-Stanley safety plan, and if needed, engage in safety planning for de-escalation. Again, if needed, we can always call 911, activate the emergency contact, or complete or enact the client safety plan should one be made. Otherwise, we're going to have the telehealth session and finish it and schedule the next telehealth session. Providers, I'm completing the safety plan. So the safety plan is in DocuSign. Let me show you where it's at real quick. Let me back out of this. I don't want to be in here. All right, hold on here. I'm going to go back. Okay. New, send an envelope providers. You're going to go to use a template. You're going to go to your shared folders, behavioral health, and it's in your clinical forms. Brown-Stanley safety plan, add selected. Okay, so I'm going to show you what this form looks like here. Actually, let me show it to you from, oh yeah, that's fine. We'll do it here. Okay, so every client should have a safety plan. Providers, this is going to be your responsibility, okay? The safety plan does not go out with the PCRs, so it's expected that during your first session, but at the very least, by your second session, it needs to be done. Psychiatrists, nurse practitioners, I am still going to encourage you guys to do the safety planning if you're that person's primary provider and they do not have a therapist. Our intakes are an hour and a half long, 2 hours. Oftentimes they would need interpreting services. So if there's time, we can do it. We can also ask our case managers or community health workers to get those safety plans completed. So there are some special sections of the safety plan that need to be in there in terms of best practice for telehealth. And those are going to be ways to restrict access to means, identification of the nearest ED and the physical address, identification of the emergency contact or support person, and any plan for in-home monitoring. Here's the safety plan, and you can't see it in here, but there are actually check boxes and notes. But there are spaces for emergency contact, making the environment safe. This is where you're going to include the restriction and means of at-home monitoring right in here. This document will live with the client and the PCRs will also upload it, but it will send a copy to the client and therapists will be able to maintain one for yourself as well. There are spots on this form for signatures for both the therapist, the psychiatrist, and the patient. But that is the gist of it. Make sure these safety plans get done. Ask me questions if you have it and how to get those appointments scheduled. So we're going now to move on to our vitals and medication/allergy reconciliation procedures.